Hi, this is Dr. Toby, your host on Health and Wellness. We have a special guest, Miss Lucinda Cook, RN. Lucinda went to Louisiana Technical College in Tallulah, and she got her LPN there at the age of 36. She was working as a correctional officer, and she noticed that people in the nursing profession were working shorter hours and making more money. At 32, she went back to nursing school, became an LPN at 36, went back to get her RN at the Southern University at the age of 42, and she got it at about 45. And today, she's working as a travel nurse. She has 3 children, and she's going to share her relationship turmoil, how she's gone from man to man, how her husband or her father, baby's father, abused her, how her mother was denigratory to her, and even how she was sexually abused as a young teenager. This story will shape your purpose and help you pursue your dreams. You don't want to miss this time with Lucinda Cook. Watch it. God bless you. Jesus is Lord. Hi, this is Dr. Toby, your host on Health and Wellness. Thank you for joining us. We're so delighted you joined us today for this show. I'm your host. I'm a family physician, and it's a pleasure to introduce my guest to you. Miss Lucinda Cook is a registered nurse in our community. She's worked all over from the ground up to now at the very top of her nursing career. I worked with her in Primary Health Service Center, and while I was working with her, she got her degrees going forward, LPN, RN, and now she's working as a traveling nurse. So we're delighted to host Miss Lucinda Cook, a local of the area. She's going to share her story, her testimony, and the trajectory of how God has brought her to where she is today. You're welcome on the show, Miss Lucinda.
Thank you, Dr.
Thank
Cope,
you
for
so
having
much.
me.
Yeah. So I know you were extremely hard working those days. You used to leave your job and go and work somewhere else. And I was like, why is she doing 2 jobs? I think you used to sit on the weekends or. So tell us exactly what happened over the last, I don't know, I don't want to reveal your age, but since high school, when you started pursuing your nursing career, how did you start? Because I feel your story might inspire some young girl somewhere who thinks there's no hope, there's no future to pursue her dreams.
Okay. Um, at the age of 28, my sister died of cancer, and I was her provider. I was her care worker. Um, at a late stage of cancer, pretty much nothing you can do but comfort. She's made it to that hospice stage, and so I provided that comfort for her. But she was in so much pain, and that's all I could provide for her. So that influenced me along to become a nurse. Um,
At the age of 28.
at the age of 28, but I
Wow.
didn't pursue it. I did not pursue it. I pretty much I did not pursue it. I continued to work as a teacher's aide. And then I got into corrections, basically. I got into corrections, was in corrections for like 10 years. And my good friend was a nurse in corrections. And I saw her work as a nurse. And that is what inspired me because I saw her working as a nurse. And me as a correctional officer, I spent 12 hours in the facility with these inmates, and I put my life on danger where she only spent maybe 20 minutes with them, and she got paid more. So that made sense to me that I had to do something different. I had, at the time, 2 children, 2 kids,
Oh, wow.
and I was the sole provider.
And what was your educational background at that point?
Just a high school.
Just a high school
Just in
diploma.
high school.
Wow.
I had tried CNA work. I paid for that tuition. I worked in it maybe 2 weeks, and I decided that wasn't for me. It wasn't for me. So that was tuition money went to waste, basically.
So at 32, you started the trajectory to be a nurse. So how did you start, and now how did you get to where you are going forward?
At the age of 32, I just pretty much I got into it. I made up my mind that that's what I was going to do, that was my way out. That was the way for me to take care of my kids and not depend on anyone else. So I enrolled myself in school, and it was a struggle. It was a battle because I was the only, I couldn't work. I pretty much just was working weekends, pretty much weekends.
So how many years did it take you to get LPN? I guess you did associates. Am I correct?
LPN.
Okay.
Okay, so here's my struggles. LPN at that time was an 18-month program.
Right.
I had so many obstacles in my way that it took me 3 years.
Wow.
It did. It was a lack of transportation, so I would have to stop because I didn't have the transportation. It was had another child, so I had to stop, and then I would pick up, but I never gave up. I just kept going. I knew it was for me. I knew that's what I had to do, so I continued to go.
So
And
after LPN, what happened?
after LPN, basically became an LPN. I loved my job. I loved being an LPN. I didn't have my money management under control, basically. I'm going to be honest with you. And so I would work Monday through Friday at Primary Health Services at a clinic. And then Saturday and Sunday, I would work at a nursing home from 7 a.m. to 11 p.m. So basically, I was kind of like, I was making the money, but I was neglecting the kids. I wasn't spending time with the kids.
And you had 3 children at that time.
I had 3 at that time. And so I worked a lot, and someone brought it to my attention. It was like, as much as you're working, you might as well go to RN school. And I was like, no, I was defiant about it. And then it suddenly hit me like, yeah, it does make sense for me to go to RN school.
Oh, wow. And how long did it take you to get to RN or registered nurse?
I took my time. I did my prereqs. My prereqs probably took me about 2 years, which would take someone else probably 6 months, maybe 1 semester. But I took my time because I paid for them myself. I worked and I paid the tuition myself.
Wow.
So the prereqs I didn't owe anyone. So my prereqs, I took 2 years doing my prereqs, and I wanted to make sure that the grades were a part. And after the prereqs were done, it took me a year and a half to complete RN program.
So you didn't have support from your parents, your brothers, sisters,
No.
husband, ex-husbands, baby father?
No.
I mean, nobody helped you financially through the journey. I don't want to say the struggle, but
No, sir. No one helped me. I worked and I did it.
some people will have taken student loans. You didn't take student loans?
I did not. I
Wow.
didn't. I didn't.
Was there a reason you didn't want to take student loans?
Well, I was already in debt with student loan. It wasn't that I couldn't take the student loan, but I went to college in 1994. I was going to be a teacher, and I didn't succeed. I failed, and so I had already owed enough money in student loans, so I didn't want to just keep on putting myself
Put
in
more.
debt.
Wow.
Yes, sir.
And, you know, talking to the single mothers out there, a lot of people don't believe it's doable to pursue your career and still take care of your children. You had that conflict, you know. So what would you say to the single mothers out there who feel they have to put all their dreams on the shelf and, you know,
No.
take care of their children and just stay at home and don't do what they feel they should do? What do you say to those women?
It's doable. It can be done. I'm living witness that it was done. I had 3 kids at the time. It may take you a little longer, but don't give up because it's doable. You can do it.
And especially the African American community, a lot of young children, 60% do not finish college. That means if you go to Grambling State, for example, they say out of every student who matriculates, only I think it's 50 to 60% actually graduate. I think either on time or graduate at all. So there's this thing about starting and not finishing in our community. And some people say it's financial. Some people say it's taking the easy way out. Some people say it's just maybe responsibilities. Maybe somebody gets pregnant in the middle of college and they have to go take care of the kid, you know. So it's something that we've seen in the African American community. I mean, what do you think of the African American female who doesn't, maybe 50% of, maybe all the nurses in America, I would say maybe less than 50%. I know, I don't know the number, but are probably African American. We don't have a large number of African American females. So the average African American female is already disenfranchised in nursing. So when you go to school, you may not see people like you. So what do you say to that person who feels those dreams that you have accomplished are unattainable, that they're illogical, that they're expensive, they're outside her parameter of achievement?
I tell them, Dr. Toby, I tell them all, it takes time. Set aside some stuff. I know we like to party, we like to have fun, but for 2 or 3 years of your life to set that aside, it's gonna be worth it. Just set aside that time and dedicate yourself to that. What I did, me at the time when I was going to RN school, my kids their they wasn't used to needs anymore. It was pretty much want. So I set them aside. Hey, this is what mama's gonna do. This is gonna benefit us in the long run. For now, your wants are gonna be set aside. We're gonna worry about needs right now. We're gonna take care of needs. And I promise you, if you just support me and help me through this journey, it's gonna pay off. So some stuff you just have to set aside and you have to dedicate it, because nursing school is dedication. It's not easy. I'm not gonna say, oh, it's easy. No, it's hard.
And you failed some exams too.
I did.
Because I remember there was a time
I did.
you were going, you had to fail once and then get up. I think you retook the exam for
I did.
RN or something.
It was plenty of times, those exams, you have to make an 80%. And if you don't make an 80%, they pretty much try to kick you out the program. Like, you don't meet it. So that's why I say it takes time, it takes dedication. The program is not easy. It's not easy. But I suggest, I love it. I love it. It was well worth it.
Wow. So a lot of young women are like, oh, I don't want to get burnt out if I work that hard to, a lot of people look at nurses, COVID, they say, oh, the nurses are burnt out. In fact, you hear stories of nurses committing suicide because of the grief and the trauma and the situation they see in the hospital daily. So what is your take on burnout in the nursing profession? Have you experienced burnout? And for those of you who don't know, burnout is a term we use for a doctor or a nurse or a medical person or even any career person who is demotivated and ill-mannered. That means you don't care anymore. You think of it as a job. You don't feel the passion, the desire, and all the things you felt about it at the beginning. So have you had to battle with burnout in your career as a nurse?
I have. And to be honest with you, it's been since COVID.
Wow.
I have, and I've taken a break. To be honest with you, I had to take a break and just pretty much that's one of the things that I like about traveling.
Okay.
That's one of the things that I like. Traveling, I was gone, I think this last assignment I was gone from October to January.
Where?
In Illinois.
Okay.
I was in Peoria, Illinois.
Oh.
And so I was gone and I missed my family. I came back, but by me being a travel nurse, it gives me time to gather my thoughts, to get myself together, to relax, to enjoy life. And then it's time to go back out. So that's one of the things. So I have experienced burnt out.
So COVID was extremely traumatizing to you. Were you in what setting were you? Ambulatory, outpatient, hospital? What were you?
Hospital.
Oh.
And what it is, it's because it's a shortage. It's a shortage of nurses, so it makes you take on more patient load. Yeah, extra responsibility. So that's exactly what it is. But you have to work as a team. You find on your shift, you gotta work as a team. If you work as a team, you can get it done. You can handle it better. But yeah, it is.
So what options do minority students who want to do nursing have? I mean, I know Grambling State, I think their nursing program has come back. I'm not sure.
Grambling has.
I know you went to Louisiana Delta College.
I started out there.
Okay.
As an LPN, I went to Louisiana Technical College
Okay.
in Tallulah. That's where I graduated from,
Oh,
grade school. As an RN, I went to Southern University in Shreveport.
okay.
When you're going to RN school, don't do like I did. I had my heart set on this certain school that wouldn't accept me. And I kept applying. I wasted 3 years applying to that one school because
Wow.
convenient for me. I felt like that school was the school I needed to go to, and it was convenient. But for 3 years, that school denied me. And someone brought it to my attention, like, why are you still applying to that school if they keep denying you? You need options. Apply not only to that school, apply to other schools. And I did. I applied to Southern, and I got in the first try. So sometimes it might not be meant for you to go to that school,
That's
but
so right.
don't set your mind on one school, one particular school. Apply to them all. You never know what you'll get.
So you can apply to. So some people just go to the HBCUs. Some people go to, but across the board, apply to whatever school gives you an opportunity.
Yes.
Wow, wow. So tell us a bit about the career of nursing. You said it helps you to take a break, feel your pulse, meet people.
Yes.
So what would you say to somebody who wants to go into nursing? Do you have to be a people lover? Do you have to be a smiler? Do you have to be a kind? I mean, what are your credentials of social, emotional component? We know you have to have academic qualifications, your chemistry, biology, and physiology, but in terms of your spiritual, social, emotional component, what would you recommend a nurse be like?
You're going to succeed to be a caring person. You have to have a kind heart. You have to be able to put yourself in that person's shoes. And once you do that, if you're caring, you're passionate about your job and what you're doing, and you're able to place yourself in that person's shoes or that family member's shoes, you'll be fine. You'll be a great nurse. You will.
And you've worked with several nurses. Anybody inspired you in the profession? You said your taking care of your sister was an inspiration to go into nursing. Now, when you were in nursing, do you want to give kudos to anybody who may have inspired, motivated, encouraged, somebody along the path of your training that gave you some nudge and encouragement when things got tough?
Um, Nurse practitioner Miss Adrian Washington.
Wow.
When I was an LPN, she kept telling me it's something more for you outside these doors. You need to go to RN school. You need to go to RN school. She just kept telling me and pushing me, you need to go to RN school. And I was like, okay, my daughter, she constantly, my oldest daughter, Mom, you need to be RN. Mom, you need to be RN. So those people, because I was content with being an LPN. I was in my comfort zone. I was content. I was tired because I worked so many jobs as an LPN, but I was comfortable. But sometimes people see things in you that you don't see in yourself. And so they pull it out of you and they motivate you to do better.
And this daughter, how is she doing now? Because one of the things I think we
She's fine.
ignore is that when you pursue your dreams, you inspire your children to pursue their dreams. So if your children see you as not pursuing, lazy, burnt out, just lackadaisical, then it's almost a picture of what they want to become. But if they see you going after what you want, so how did she turn out?
She turned out amazing.
Wow.
She's actually an entrepreneur.
Oh, wow.
She's a healthcare administrator, so she has her own seating company. She provides direct
That's awesome.
care for people who needs it. So that was
In
amazing.
the city, wow.
Yes.
That's awesome. That's amazing. So you need people like Miss Adrian Washington. You need people like your daughter along life's journey. Tell me, what do you think we can do to help the nursing shortage? I know it's a recurrent dilemma. We have an extreme shortage of nurses, and people say it's COVID. People say it's lack of training positions. People say it's student loans. What do you think is responsible? How can we solve this perennial problem in our medical community?
Well, I was told that some nurses with COVID, they actually end up retiring. Like they didn't want any
Anything to do
part
with
of
that.
it. They just rather not deal with it. And so I think that we got to work on the shortage, first of all. So you can keep the nurses that you do have,
Right.
because if you don't, they're what we already talked about. They burnt out because these patients that's in the hospital, they are acute patients. They need our help. They need us to be there. So when you're giving one nurse 10 patients, that's not quality of care.
Right.
That's a lot of
Compromise. Yeah.
yes, it is. So we got to figure out a way to get these nurses, get them in.
So it's a different model. So in England, for example, nurses end up as matrons, they end up as chief administrative officers. But most of our nurses in our United States end up as nurse practitioners, working as clinicians. So personally, I think a little bit of the issue is we have a pipeline that goes in several directions. Less than 50% stay in the clinical side. They end up, working as clinicians, or they may be going to academia with their advanced degree, which is a good thing. It's just that it ends up affecting the pipeline, so that
Yes.
we don't have as many clinical hospital-based nurses like we would normally have had. Yeah. So anyway, it's a topic for another day that we'll talk about over and over again. So let me get your take on faith and nursing. So how has your faith affected your practice of nursing? Tell us a bit about that. Because I, as a physician, my faith is very pivotal. If I care for somebody, if I show love to somebody, I know that Jesus said, if you've done this to the least of this, you've done it to me. So I go out of my way to give everybody quality care, because it's not just a patient. To me, he's an extension of God's creation. So how has your faith shaped your nursing practice?
Well, Dr. Toby, like I said, I put myself in that patient's shoes. Not only that patient, but that family member. I put myself in their shoes. Like, how would I want someone to treat me if I was in that situation? How would I want to be treated? So that's pretty much how I treat all of them. You
Right.
know, no matter what, I treat them all the same. You, that's what we're here
Black,
for.
white, red,
Yes,
Hispanic,
yes, that's what.
love. Jesus is in each of them.
Yes.
Yeah. So some of my viewers are young, 16-year-olds. They want to go into nursing school. Can you put them
Yo.
through the modules, the courses they need to take? For example, high school courses, then prereqs to get into nursing, then prereqs to get into RN. Those little details. A lot of them are ignorant of that. Do they need mathematics? Do they need
They do. They will.
science? Do they need biology? What do they need in college and high school to get into nursing school?
When you're going, don't get discouraged. You're gonna take a lot of classes that you're gonna be like, oh, I don't need this. Why am I taking algebra 1, algebra 2, chemistry, microbiology? Those are classes that they're prereqs. They're prereqs. Will you use them? Some of them you will use. Some of them you won't. But it's required. Math, statistics. Oh my God, I hated math, statistics, but I had to do it. That's what was needed.
Statistics.
Statistics.
Okay.
Yes. Oh my God, it's hard class. But do I use it in nursing? No. But it was one of the prereqs that you had to do to get into the program. So you have to do them. And be serious. Don't just take the class and think that you're gonna see your way on out. You know, because nursing is competitive, and when you're getting into the program, they go by those grades, they go by those GPA. So you have to give it your all. You have to take, like I said, just take time out of your busy day. If you dedicate at least 3 hours just in a quiet room with just you by yourself and your books, dedicate 3 hours to it, get to learn it, put in the work, and you'll be fine. You'll be fine.
That's awesome. Tell me a little bit. Age was not a barrier for you. I mean, when you went to school, when you went back, I'm sure you saw younger girls.
I did.
You were the older, maybe of the. So how did that affect your training? I mean, you seem to be a thick skin. You don't get
I
phased
did.
by a lot of stuff. But maybe there's some 30-something, 40-something-year-old ladies listening, and they want to know, how can I go back to school at my age? How did you handle that?
When I went back for RN, I want to say I was 42,
Wow.
42 or 43. And it was your younger group. I had Some was older. It was some older ladies in the class with me. I'm kind of like a shell. I don't communicate well with people I don't know. But I learned in nursing school, you all trying to survive. You all are trying to pursue the same thing. And so communicate with other people. Because these people, they may have a study guide for you. They may have a way you're studying may not be getting it. You may not be getting it, but you can communicate with someone who's younger and they've picked up another way to study and they can show it to you and it may help. So communicate with your fellow classmate is what I'm saying. Don't just go up in there and think it's just you against the world, because it's not. Everybody's in their classroom trying to pursue the same career and trying to do the same thing.
Tell us a bit about travel nursing lastly. So I hear it pays very well. Obviously, you have to stay away from your family a little bit more. Other other advantages are you get to see the world.
You do.
You can go to every state, Hawaii,
Yeah.
San Diego,
Yes.
places that you may never have dreamed of. They put you in hotels. They fly you in and out. You know, so those are the benefits. I'm sure the disadvantages are obviously time away from family and
Time
all
away.
that.
Yeah.
So have you found travel nursing desirous? Have you met people on these journeys? Has it opened your vistas to America and what
Yes.
America can offer potentially? Because if you live here, Monroe is all you've seen. You may never dream bigger than just Monroe.
Um, Becoming a travel nurse was one of the best things that I could have done. I debated on it for a long time. I don't know, but it's always been a dream of mine. When I became a nurse, I put on it, I'm going to become a travel nurse. Never had travel. Never had travel since COVID. Never did a travel nurse. I've been a nurse over 10 years. And when COVID hit, I actually did a travel assignment. And I met some wonderful people who think outside the box. They brought to my attention, well, you know, you can do this, you can do that. And it makes you think outside the box. Like Dr. Toby said, when you're in Monroe, you're limited to such things. You don't think big. You don't do dreams. But I met some wonderful people, and they did.
So wow, that's awesome. So we've been talking to Miss Lucinda Cook, a local of Northeast Louisiana, a woman who started nursing school in her 30s and ended up today as an RN travel nurse working in different parts of America, a mother of 3 successful children and obviously grandchildren, I'm sure by now.
Wow.
She's sharing her one grandchild, and she's going to be sharing her future dreams and prospects and how God has brought her to where she is. She's going to talk about her love life a bit. She's going to talk about her background, where she came from. You don't want to miss this story with Miss Lucinda Cook. God bless you. Jesus is Lord. Amen.
Amen.